My name is Melinda Abraham. I will be doing your head to toe assessment today. This exam is completely confidential and you have the right to refuse. Okay, I'm going to start off by looking at the skin of your face, and everything on your face looks good. I'm going to palpate your scalp. If you have any tenderness, let me know.
Okay.
The hair is, she got a full set of hair. Everything's symmetrical. Okay, I'm going to also test your expressions for symmetry. So I'm looking at that now. I inspected your scalp and cranium. I'm going to feel of your temporal arteries. I can feel both of your arteries at that time. And then also your temporal mandibular joint. Open and close your mouth. I don't feel any clicking. Do it one more time. Okay, good. No clicking noted. All right, for cranial nerve 5, I want you to clench and hold your clench and hold against resistance. Okay, good. All right, and I also want you to close your eyes and tell me when you feel this.
I feel it. I feel it. I feel it.
Good, very good. Okay, cranial nerve 7, I want you to smile, frown, show me your teeth, puff your cheeks out. All right, very good. That's your motor function for cranial nerve 7. Cranial nerve 2, we're going to test your visual acuity. We have this on the wall, so if you move back there and she's going to read. Start with the lowest line. Cover one eye. And what is the lowest one you can read?
F D P L T C E O.
Perfect. Now cover your other eye and read it backwards.
O E C T L P D F.
Perfect. Okay, have a seat. So she has 20/20 vision. And you're not wearing any contact lenses, right? I should have asked you that to begin with. Okay, cranial nerve 3, 4, and 6. I'm going to test your extraocular movement. Okay, so without moving your head, I want you to watch my finger and just move your eyes. Very good. And her eyes moved symmetrically. All right, now I'm going to look at your pupils. I'm going to look at the size. Get my light. Guess what's not working? Okay. I'm going to look in your eyes. Just, okay. So her pupils are about a 4 millimeter, and they're equal and they react to light, and they both move symmetrically. Okay, so I'm going to test your eyes for a combination and convergence. So look at this pen, and then focus on the pen, and then focus on back wall. Okay, do it again. Okay, so her eyes do come together when she's looking at the pen. They converge and then accommodate in that way. All right, now I'm going to look at your eyebrows, your eyelids, and your eyelashes. And if you're having any pain, of course, you let me know when I touch you, okay?
Okay.
Okay, so everything's symmetrical. Her eyelashes are symmetrical. I'm going to look at the sclera and her irises, her pupils, everything looks good there. It looks clear. The conjunctiva, and okay, now we're going to go to the external ear. You'll let me know if you have any pain in your ears when I'm touching you. Okay, I'm going to look in your ear. I don't see any drainage. Looks good. Okay, no drainage there. Okay, let's go ahead and go to the mouth. Let me look in your mouth for just a second. Okay, open up your mouth and let me look. Okay, she does not have her tonsils. I did her assessment and she told me she has had her tonsils taken out, but if she did not, I would grade them at this time. I'm also looking at her teeth, gum. The soft palate is pink. Say ah. Okay, I see the movement of the uvula. Stick out your tongue. All right. Now I want you to hold against. Let me open your mouth. Okay, hold against there, and there, and there. Okay, and everything looks good there. I'm sorry. Test your gag reflex. Open up. Okay. All right. And stick out your tongue one more time. Okay, I'm testing for symmetry, and everything looks good there. All right, so now we're going to be palpating your lymph nodes. If you have any pain, you let me know, okay?
Okay.
So the preauricular lymph nodes. post-auricular, occipital, the submental, and the submandibular, the tonsillar, and the deep cervical chain, subclavicular. I'm not feeling anything. She's not complaining of any tenderness there. All right, so I'm going to test your cranial nerve 11. So I want you to touch your chin to your chest, okay? And then turn your head side to side. I want you to touch your ear to your shoulder. Extend your head backwards, okay? All right, now I'm going to hold resistance, so push against my hand. Push against my hand here, okay? She's strong. Okay, I'm also going to palpate the trachea and her thyroid now. So you're okay with there. Now I'm just going to feel on both sides, and I want you to swallow. Okay, swallow one more time if you can. Okay, great. All right, so there was no tenderness there, and it felt soft and spongy. All right, so I'm going to feel your carotid pulse real quick. One at a time. Okay, her carotid pulses are strong. And I'm going to use the bell on my stethoscope to auscultate for any bruit on her carotid pulse. Now, I just want you to take a breath and hold it. Okay? One more time. Okay, sounds good. I don't hear anything. All right, now we're going to inspect and palpate the posterior chest wall. So let's see, what I get you to kind of, can you just turn around kind of Indian style that way? That way you can still stay there. Okay, so I'm going to use, can you see me? Okay. All right, let's see. Sorry about that. Okay, inspect and palpate. Okay, now what I'm doing now is a tactile fremitus. I'm just going to raise this above your head. All right, so when I touch you, first of all, I'm inspecting and everything is symmetrical. She has no problems with her skin on her back. Everything looks good. The tactile fremitus, when I touch you like this, I want you to say 99. Say it loud so I can hear you.
99.
Okay.
99. 99.
One more time.
99.
Okay, sounds good. Okay. Everything seems to be over here. Wait a minute. All right. Now I'm going to percuss over the posterior lung fields. Okay, now what I'm testing for here is any costovertebral pain or tenderness. When I percuss, you let me know if it hurts you. Okay.
Okay.
Okay. Everything good?
Mm-hmm.
All right. I'm gonna listen to your lungs now. All right. Every time I move the stethoscope, just take a deep breath and let it out. Okay.
Okay.
Okay. And one more. All right. Sounds good. All right. So we can go ahead and get you turned back around. Okay. All right, so I'm going to be looking at your arms. I'm going to look first, of course, the symmetry, and you don't have any problems with the skin of your arms. I'm going to palpate your radial, brachial, and ulnar pulses. Okay, I'm feeling both all equal and bilaterally. I'm going to test for capillary refill. Okay, it's brisk, quick. Okay, now your range of motion of your shoulders. I want you to lift your arms above your head. Okay, and then extend your arms behind your back. All right, and then I need you to put your arms out to the side and back down. Okay, and then your shoulders, your elbows in and out. Okay, now I want you to do that against resistance. Pull and then push. Do it again. Pull and then push.
You push.
Okay, gotcha.
Sorry.
All right, so now that's the flexing and extending of the elbows. Flex and pull against resistance. We've done that. Okay, now your wrist. I want you to flex your wrist up and down. Okay, open and close your fingers. Okay, make a fist. Okay, now you touch your thumb to each finger. Okay, now I want you to touch your nose like that. Yes, and then the other one, and then go quicker like this. Got it? Okay, that's your cerebral functioning. Okay, now grab anesthesia. I want you to close your eyes, and I'm going to draw on your hand, and you tell me what number I'm drawing.
7.
Okay.
3.
Good. Okay, and another test. Where are my items? Okay. I've lost mine. Oh, in my pocket. Okay, I want you to close your eyes again. I've got an item I'm going to put in one of your hands. Tell me what that is.
Key.
Okay, and tell me what this is.
A coin.
All right, you can open your eyes. Good. Okay, your triceps, biceps, and brachial reflexes on each arm. All right, so I'm going to need you to relax your arm. Oh, okay.
You gotta stand.
Okay. All right, now the okay. Just let's see if I can do this backwards. Okay. Can you see me? All right. And okay. All right. Let's see. We've got to. Okay, I'm gonna get you to lie back, please. All right. So now, what I'm doing at this time is I'm gonna inspect just the work of her breathing. You might want to scoot over this way a little bit. There you go. Can you still get us both in like that? Okay, so I'm just inspecting the work of her breathing. It's non-labored. She's not having any difficulty there. She's not using any intercostal muscles to breathe. Okay, I'm going to feel for any thrill. I'm looking for any pulsations or thrills. And she has none. Alright, so at this time I'm going to listen to her heart. I'm going to listen to the aortic, pulmonic, mitral, and tricuspid. I'm going to start with the diaphragm of the stethoscope first. Okay, and I'm going to do the same thing again with the bell of the stethoscope. Okay, sounds good. Alright, so at this time I'm going to look at her abdomen. I'm inspecting the skin, so I'm going to inspect first before I auscultate and then palpate. So everything looks symmetrical. I don't see any obvious peristalsis or anything that would cause any concern. Okay, so after I've inspected, I'm going to listen to I'm looking for contour, symmetry, and any visible peristalsis. I've done that. I'm also looking at the umbilical area to make sure there's no hernias and make sure that the contour is good. I'm going to listen to, using the diaphragm, I'm going to listen to all 4 quadrants of her stomach. Okay, I'm hearing bowel sounds all 4 quadrants. Now I'm going to lightly palpate. Tell me if you have any tenderness, okay?
Okay.
Okay, nothing? Mm-hmm. Okay, so I'm going to palpate just a little bit harder this time, or deeper. Okay, everything feels normal, so I'm going to try to see if I can feel the liver. Most likely not, unless there's a problem. Okay, I'm not able to feel the liver. That's good. Alright, so now we're going to go to the lower extremities. I'm looking at the skin for any abnormalities, and everything looks good. Her legs are symmetrical, no problems there. I'm feeling for the popliteal arteries. I'm going to feel their pulses back here. Okay, I feel both of them bilaterally. I don't see any edema. I'm also going to feel both of her pulses, the dorsalis pedis pulses. They're both equal, and I can feel both of them. Okay, I'm going to also test your range of motion, so I need you to raise your leg, like one leg and then the other, to like all the way up like a 90-degree angle.
Okay.
Okay. All right. Now knee to chest. Okay. All right. Now out to the side. Okay. Okay. Now let's see. I need you to bend your knees. Just kind of point your knees outwards to flex your hips out. There you go.
Yeah.
Yes. All right. And then I need you to flex your feet and then go this way with them. Now I'm going to put some resistance on here, so pull your feet towards you, and now push. Okay, and those are strong. That's okay. All right, now I want you to sit back up right here to the edge of the bed. All right, so now this is going to test your I did not do your Babinski reflexes. I should. No, that's fine. I can do it here.
Okay.
Okay. So. Okay. And I was checking to see if her toes fanned out for that, and they did not. Okay. So now your patellar reflexes. Okay. There you go. Okay, and those are good. All right, so now your cerebellar functioning. I need you to take your heel and run it down your shin. Okay, and do the other one. That's good. Okay, and then I need you to stand up. I want you to walk on your heels towards that wall, and then come back and walk on your tiptoes. On your tiptoes back. That's good. Okay, now stand here. I'm going to do the Romberg test. So if I had any thoughts that you would fall over or faint, I would be here to catch you.
Okay.
So you're just going to close your eyes, and I'm just testing your balance. Okay, close your eyes. Okay, so there's not even any sway, so she has very good balance. Okay, muscle strength. Okay, now I'm going to ask you to hop on one leg. Okay, other one. That is testing your muscle strength. Okay, now we're going to look at the spine. So I'm going to turn you this way so he can still see what I'm looking at. Okay, so I'm going to pull this up so I can get a good look at your spine. Everything looks symmetrical. There's no abnormalities. Everything looks straight and symmetrical. So I'm going to ask you to do a few things. I just need you to bend over, touch your toes, and then come back up. All right, do it one more time. I'm also looking at her spine to make sure it remains symmetrical when she does that. And then, okay, so I want you to bend sideways, one side and then the other. Okay, and then twist your shoulder from side to side. Very good. And that would be the end of the test. Thank you.